Supporters of Medicaid expansion know what they're facing here in Jefferson City, a legislature that's going to turn it down. So they want to turn up the heat on those legislators, and not just here at the Capitol, but back home. And for that, they want a very public debate. Shortly after he was reelected, Democratic Governor Jay Nixon traveled the state to announce his support of Medicaid expansion. One of his stops was at the BJC campus in St. Louis.
I've come here today to announce that the budget I plan to submit to the legislature for fiscal year 2014 will include the federal funding to provide health care for an estimated 300,000 more Missourians, men, women, and children who currently have no health insurance. It is time for us to move forward.
Opponents have been focusing on the cost of Medicaid expansion. Proponents think they are ignoring the savings and the benefits, and that's what Nixon came to talk about, citing a University of Missouri study on the economic impact of expanding Medicaid.
Now, it is the smart thing to do, and it's the right thing to do. There is a clear economic benefit for Missouri. That study showed that the additional funding for health care will create 24,000 new jobs in Missouri in 2014 alone.
The economic impact study says many of the new jobs, more than 5,000 in the St. Louis area, will be in the healthcare field.
And these are good paying jobs. We hire pharmacists, we hire therapists, we hire technicians.
The president and CEO of BJC Healthcare is Stephen Lipstein.
All the people that support the delivery of hands-on patient care. So we are the largest employer in the state of Missouri. And our ability to continue to sustain that employment base in support of providing outstanding patient care is contingent upon the legislature approving the governor's program for expansion of Medicaid.
The bottom line in this study is that the investment in Medicaid expansion would more than pay for itself. In years to come, by spending millions, Missouri would get back directly and indirectly billions. The study was prepared for the Missouri Hospital Association and the Missouri Foundation for Health.
It's one argument to say this would provide health insurance to some of our most vulnerable residents. And that is an argument that resonates with some people. But the economic argument is also of great importance to some of our policymakers, and they want to really understand that side of the Medicaid expansion.
I think we've got a solid argument. I think that this is a persuasive case as to why we should move forward, and I look forward outside the context of political campaigns to move to what I think is a more constructive level of discussion about what's best for the long term of the state. And in that.
So the federal Medicaid money is going into the governor's budget, and proponents argue that if Missouri doesn't get the money, it will be spent in some other state. And they remind us that for the first 3 years, it comes at no cost.
Well, if Missouri chooses not to expand Medicaid this year, which they will choose not to expand it.
State Senator John Lamping explains that opposition to Medicaid expansion stems not from a disagreement that all Missourians need access to good quality health care, but a difference of opinion on how to pay for it. And he says those details just aren't clear.
What they've offered us is a contractual agreement to enter into, but so many of the details of the contract is actually still being written. So, for example, when they say that they will cover 100% of the expansion's cost, well, it hasn't been determined yet what actually will or won't be covered. What does it mean? What is the cost of the Medicaid program as it expands all around the country to these higher levels?
It sounds like the contract from the federal government is an all or nothing.
Exactly.
So what's our plan?
Our plan is to ask them to reconsider that proposition.
While those both in favor and against Medicaid expansion believe the current system is broken, they cannot agree on how to fix it. Those opposed say we can't keep throwing good money after bad by expanding entitlement programs. And supporters say getting people health coverage is the best way to start reform. But Senator Lamping says expanding Missouri's minimum coverage will cost so much, and he's concerned the federal government won't be able to continue paying its share.
What I'm being asked to consider, and we, the General Assembly, asked to consider, do you enter into this financial agreement with the federal government when at a time when you can question the financial stability of the federal government?